Welcome to Fort Worth Innovates, a show about innovation, research, entrepreneurship, and startups in Panther City. My name is Cameron Cushman, and I'm the host of this podcast that brings you the stories of the people that are putting our city on the map as a leader in innovation, with the help of the Fort Worth-Tarrant County Innovation Partnership. My guest today is Dr. Chris Naler, the Chief Operating Officer and Vice President of Growth and EdTech at General Genomics, a Fort Worth-based company that is dedicated to creating innovative systems that improve efficiency, reduce risks, and support their clients' critical missions. A retired Marine Corps colonel, Dr. Naler is working to build this company, rooted in national security and biotech, to bring AI and ML solutions to market. They are dedicated to enhancing military operations and healthcare logistics through their Curo 46 AI platform. Chris, welcome to the Fort Worth Innovates podcast.
Well, thank you, Cameron. I appreciate the opportunity to be here. It's an exciting time to be in Fort Worth for me. Very excited because this is my hometown. And here I am. I have the opportunity to lead and grow a unique, truly leading edge company and support a phenomenal team and serve them. And it's just an exciting opportunity for us from an applied AI as well as research driven growth. That's really our focus. Not only meaningful in the larger sense, but I'm essentially right about my 2-year anniversary when I joined the company. And we have grown exponentially, and we just continue to grow in our talent, in our employees, and also in our capabilities, hardware, software, intellectual property, you name it. So exciting time. Thank you, Cameron, for the opportunity to be here.
Outstanding. So I just did the intro. You just told me a little bit about the company, but how do you describe General Genomics in your own words?
Founded actually in Midland, Texas. So founded by our co-founder, AJ Rosenthal, in 2020, a very interesting time, obviously, in the United States and the globe for that matter, with what was going on with the pandemic and things of that nature. So, GGI is, our focus is solving the most challenging problems, frankly. And our focus is in the biotech, bioinformatics, national security space, but really looking at predictive analytics. How do you employ artificial intelligence? How do you employ machine learning to solve those high impact problems across healthcare, bioscience, national security? Yes, and also in the bioinformatics space. All of that these are the most challenging problems. And for us, what motivates us is solving these problems because we're making the difference in people's lives. That's what gets us up in the morning. We're an AI first company. There's a distinction. There's what's known as AI enabled. So I use a little bit of AI to help me do my work. And then there's AI first, where we look to solve every problem possible first with an AI solution. So we like to call it, we're kind of a little bit of a biotech skunk works, if you will. And we enjoy that moniker because we're not a big team. We're not looking to be, 1,200 employees. We're a lean team in how we approach problems. I am very fortunate to serve alongside just a variety of talented individuals. And in about a period of 8 weeks, we are creating new science, new technology that's going to positively impact folks in the healthcare space, particularly folks with neurodegenerative diseases like Alzheimer, dementia, things of that nature. I think what's important for us is really maybe some of those key aspects that go to what makes up the company. We have a published machine learning patent that is a disease susceptibility patent for all living organisms for all illnesses and diseases. And I won't go too much in that because I think it's still kind of mind blowing for people when we talk about it. Just the expanse of it. But that patent, all of our products that I think we'll probably talk about, Cameron, a little bit, are built on that machine learning patent. What's probably really a unique selling proposition for us is we also have an organic data lake of 650 plus million records. That data lake is comprised of about 46,000 diseases, and there's only 72,000 diseases, if you will, if you look at the actual requirements or the coding, if you will, of diseases. So that data lake is just a rich data set that we use for testing, training our models, a variety of different uses, all the way up to building synthetic data, which I think we'll talk maybe a little bit later. But we take these unique data sets, and some of them are very sensitive data sets. Some are longitudinal. We have one data set of one particular um, autoimmune disease that has over 40 years of longitudinal study of 40,000 patients. That's a pretty powerful data set that could really move the needle for folks with autoimmune diseases. But we take this data, and that's the key thing. People ask me, okay, what's AI? What's machine learning? The reality is this: the horse of AI, the power of AI is data. It's not the people, it's the data. Then you apply the people, then you apply the hardware. That's where our little team, that's where we're a powerful little team building models and solving challenging problems.
Everybody knows AI. We hear about it all the time, artificial intelligence. You also talk about ML, machine learning. Can you kind of define those terms for us and really tell us the difference in the two? Because I think sometimes they kind of sound like the same thing.
Yeah, no, that great question. So there's a level of distinction, right? That think of artificial intelligence really as a broader capability of machines performing tasks that typically require human cognition, such as reasoning, pattern recognition, and decision making. So that's probably the tightest definition I can give you for AI. The next is machine learning, which is a subset of, let's say, the overarching umbrella, if you will, a subset of AI. And it's really how systems learn from data over time and they improve without being explicitly programmed, meaning the machine in the definition is learning and growing. It is cycling and improving its understanding of the data set, of the training model that it's been provided. Think of it this way. This is kind of that bottom line, right? Simply put, AI is the outcome and machine learning is the engine that enables that outcome.
That makes sense. So you've talked a little bit about the data sets and how you're going to approach these problems, but can you kind of drill down a little bit and tell us about some of the specific problems you want to solve both in healthcare and in national security?
Yeah, first off, and I think this is an important thing for our exchange and obviously the listeners is this. When we think about healthcare, we obviously are passionate about our health, our family's health, right? Very rarely do we think about healthcare as a national security priority. And the reality is this: our citizens, their health, our well-being, that is directly linked to national security. Not just the ability to grow, train, equip our military, but also our other agencies that provide security, but also the innovation of the nation, the ability to have innovation and create solutions. That's also part of our national security. Well, when we focus on environments where, yes, there might be an abundance of data, which does exist, but also there's also some environments, there's an incredibly paucity, a shortage, if you will, of data. And we have to find ways with that limited data to make key insights. And that's once again back to the AI ML, particularly from the ML perspective, the ability to extract and understand depending on what that data set is. So let's look at healthcare. For us, we have a variety of projects we're working on. We are very passionate about neurodegenerative diseases, particularly Alzheimer, dementia, and that, if you will, what's known as kind of the cascading effect of or the cascade of Alzheimer's. Um, when you look at those challenging diseases, what's amazing to me is um, I'm not a scientist, I'm not an MD, but I think what's amazing is the lack of understanding we have about the brain. So wouldn't it only make sense that if we have a lack of understanding about the brain, let's enlist a partner, let's enlist a tool like AI and ML to help us understand even more about a complex thing about the brain. And the irony is this: we're using our tools to understand the brain, and these tools are actually replicating the brain. Now think about that one for a minute. So from our perspective, our patented approach allows us to move upstream and identify risk before clinical systems sometimes are fully manifested. That's the predictive nature of our process, of our tools, of our products, of our little engines, if you will. We kind of joke and say we're making little engines, and those engines are models, and those models have the ability to do predictive analytics upstream. Um, Historically, when you think about in the healthcare space and maybe even the national security space, historically, these problems are addressed through retrospective analysis and static reporting. That's reactive. And I like to refer to this with my team. I'm like, guys, don't tell me history. Tell me something I don't know. So when you think about from the standpoint of predictive analytics, unveiling, okay, revealing new patterns, new new connections, that's the magic of AI ML.
Very cool. Yeah. And boy, there's no shortage of problems to solve and neurodegenerative diseases. And I think you're in the right place to do it in Texas because of the new DPRIT program that's coming up. And there's already a lot of research going on here locally in the Fort Worth area on those very topics. But you talk about your solutions. You talk about the problems you're trying to solve. But tell me a little bit about about your clients. Who are your clients, and how do they use your services, and how do you help them?
Yeah, a great question. And just for what it's worth, I'll be very generic about our clients out of
Sure.
respect for their privacy. But I think the heart and soul is really to your question about how do we support them. So we have a variety of contracts. We have a contract with the Department of Defense or Department of War with one of the principal labs. Um, this is to analyze a very challenging problem that is not necessarily identified. Um, we've been brought in as the AIML partner to do the analysis, if you will, of the clinical data that is necessary to solve this problem. That was really our first government contract. Very excited about that. We're in our second year, and things are going well there. That really gave us a chance as a young company to cut our teeth on our first, if you will, really challenging contract and really collaborate with a variety of professionals. So there's one example we have. We're currently in the process. We're about 3-4 days away from starting our first contract with a large Texas public university with a medical school. I'll just leave it at that. And we looks like we have up to 4 projects with them, and these will be focused. Half of the projects will be focused on the neurodegenerative space, and then there's a few other clinical areas that are related to different type of diseases and illnesses. We also have a commercial client within the mid continent, if you will, and that commercial client is a healthcare provider, has multiple facilities. Let's say about a dozen facilities, right around 500 patients. That's where we have deployed our what's really going to be our flagship product, flagship application that's going to be called Cure Risk, and Cure Risk will be eventually deployed in one of the hyperscalers on one of their marketplaces. But federal government, state government, so as well as commercial is, and also we're in pursuit, if you will, of collaboration with pharmaceutical as well as additional mid and larger insurance companies, because part of what our product can do is not only help from a to support diagnostics. We don't heal, we don't diagnose. That's not what we do. What we do is we are an additive capability that would allow a healthcare professional to better understand what may be happening with their residents, with their patients. Um, but that's a little bit from a scoping perspective of what our clients are. The other thing we have, and I think this is important when maybe we talk about later, Cameron, is we also have an EdTech program that really allows people, much like your question, hey Chris, what's AI? What's ML? Well, there's a few million people out there that want to understand that. And what we've done is we've developed an EdTech program, an educational technology program into a professional development, if you will, suite of classes that um, allows mid and senior leaders, executives to come and participate in a 1-day workshop. And it really gives them an understanding of one, it gives them a safe place to ask questions they may not want to ask in front of their 21-year-old engineer, right? And that's one thing we always joke about. But the other piece of that, Cameron, is it gives them a chance to pause, step back, get some space, and really look at how their company, their organization, whether a nonprofit, higher education, federal, state, whatever the case may be. And we've worked with a little over 800 participants or attendees of our courses. And that's been in classes as small as 11 and as big as 31. So when you look at the number 800, you're like, hey, 800, not a big deal. It's just a Zoom call. No, no, no. This is in person, kneecap to kneecap. They're hanging out with me and the colleagues that I teach with, and we continue to help them understand. And that's really, I think, as much as an important piece, almost a little bit of AI discipleship, if you will, so they can better understand and grasp what is this thing called AI.
Very good. Well, let's sort of drill down a little bit more because I mentioned one of your platforms that you're actually doing the work through, your Curo 46 platform, but you also have a platform called, and I guess it's SYN or SYN 46 platforms. Can you tell me about those and how they play a role in your business?
So think of Curo 46, as I said earlier, you've got this engine room, and in the middle is Curo 46. Curo 46 is that is our engine room. That is our principal data. That is our on-prem hardware, if you will. So we're in two different data centers, one up in Oklahoma, one down here in Fort Worth, and as well, we have a little bit of hardware on site. All of that combined really puts together the knowledge base of the company. And that also helps us generate our small models, large models, our client models. Cameron, when you go to the doctor and you finish a doctor visit, you get a medical record, you get a report. Your doctor probably gives you a piece of paper that you take home, and that's recorded electronically. Well, that is a single medical record that says, you know, gives the vitals, gives all the details. That's a single record. Well, remember what I said earlier. We have an organic data lake of over 650 million records of over 46,600 diseases. Now, I can't get into all the details because one, I've got the skills, but I don't have the skills to the level of my colleagues that can speak to this to the level that I think will maybe melt your mind. We're very excited about it, and that actually our first debut of that is about 90 days away with one of our current clients, and we're very excited about it.
Very cool. Better, faster, cheaper, right? That's what all this is about. And yeah, that no human can go through 46, would you say 46,000 diseases? I mean, that's incredible. So you are a retired colonel in the United States Marine Corps. Thank you for your service. How has your military background contributed to your approach and your ability to work in this company?
Yeah, I love the question, Cameron. I was blessed. I mean, about 1,000 meters from where I'm standing right now in my office, I went to the recruiter in 1986 and joined the Marine Corps. And I was blessed to serve 28 years with just America's finest, some of America's finest, right? I respect all the services. Um, I think what it's really allowed me to do. When I retired in 2014, I started working in the government contracting space, both in defense, national security, and saw a variety, had successes and had some failures. Definitely, the old saying, you always learn more from your failures than you do your successes. And I can definitely say that this is my fifth private sector company, fourth private sector company since 2014. And obviously, I'm in a very different role. But I think the thing that I find true and what I learned in the Marine Corps as a leader is this. There's a Marine Corps saying, a leadership saying, says, employ your Marines within their skill set or within their military occupational specialty. So in a civilianized version of that would be employ your team within their skill set, right? That very often it's easy to want to stretch people into areas they're not qualified, and that can get a little bit tricky. But by the same token, in this space, and this is where I get challenged, I challenge myself all the time. I can't live with that all the time saying, I've got to stretch my team. And they're stretching me, right? They're stretching me more than I'm stretching them just based on their talent. But I refer back to that, and I think the other one, not necessarily a hallmark, if you will, in Marine Corps leadership, but the thing that I really look for, and I think is allowing me to serve and support my teammates, support the leadership, support our clients, is getting the right talent. We've been very blessed, Cameron. We've only been in town. We opened this office January 2025. We've added 9 employees. 9 employees have been added. So that's, we're not a defense contractor adding 50,000 employees. But when you add 9 employees to a town like Fort Worth with the talent, what these guys are doing, one of the things, back to your question from leadership, is this: I'm looking for people, we're looking for people that are curious and want to solve challenging problems. That is exactly what I found in the Marine Corps. I found young Marines that were hungry, they were willing to explore. They wanted to color outside the lines, and you had to provide them top cover so they could color outside the lines. And I was very blessed in my career to be able to lead Marines and sailors in different capacity, that a few organizations that we were the first doing some of that. And I just continue that on today. But thank you so much for that question.
How have you been working with Texas A&M Fort Worth and the Fort Worth Tarrant County Innovation Partnership? Because I know you guys have connected. Tell me how that relationship has gone.
Yeah, so hats off first off to Denise Canales, the executive director of the Innovation Hub. I met her through actually the realtor that helped us, uh, Jerry Bowles and his team, who helped us get this get our office here. And he goes, "Chris, you need to meet Denise." So I met Denise. We met pretty early on, had a cup of coffee, had lunch, and I just want to say one thing just about Denise: proven leader, successful entrepreneur. She's been there, done that, and I couldn't imagine having a better person at the helm for Texas A&M Fort Worth than having Denise. And so really started with Denise, and she said, "Chris," I explained to her some of the work we're doing. She loved it. Explained to her the EdTech stuff we're doing. She goes, "Chris, I want some of that. Let's find a way to get that into Fort Worth." And that's where she introduced me to John Hawkins, and that was really the connection to the innovation partnership. So now working with John and also Amy Vance, also working in the professional development, just 3 delightful colleagues, and just excited about it. And that's right now where we're at from the collaboration. But I'll just offer this. Um, in December 16th of last year, A&M Fort Worth hosted a neuro summit with Texas A&M Medical School, Cook's Children, and GGI attended that. And that summit really showed us the quality of folks that are right here in Fort Worth. And granted, they can drive up from College Station, or we could drive down there, but just the power of the innovation center and their ability to bring in that kind of talent, but also just start creating an environment where there's the exchange between these different organizations. That to me is what's powerful. But that's frankly, Cameron, that's why I'm here with you, because through Denise and meeting John, and hopefully the rest is going to be great history.
So, Chris, as I recall, you guys have an event coming up. Tell me a little bit about the AI for Executives Professional Development one-day workshop.
Yeah. So one, thank you, Cameron. It's a great opportunity, and it kind of ties to some of our previous conversation. When I met Denise Canales, probably shortly after we arrived here in Fort Worth and opened our office, we talked to her a little bit about just some of our EdTech stuff we're doing in Oklahoma City with the Air Force, also with the FAA and a few others organizations, both federal, state, higher education, private sector. And she was very interested in bringing that to Fort Worth. So what we've done is we're bringing our AI for Exec course, the same one we've taught about 35, 40 iterations, approximately about 800 total personnel between AI for execs, AI for engineers, AI for analysts. But we're bringing the AI for Exec course here to Fort Worth, and we're gonna present that. Um, our first course is going to be in May 29th of 2026 in downtown Fort Worth. And it's a pretty interesting, we've compressed it into a one-day workshop, and that's really the goal, is to attract middle and senior level executives with a level of expectation. They don't just come and get, death by PowerPoint, a bunch of slides, but they bring problems, they bring maybe challenges they're having, and we actually workshop, we solution. So kind of the overview is we'll do a basic introduction. We'll talk about the history of AI. We'll talk through the terminology. There's really 14 terms we're going to train. And you've already asked me 2 of them today. You asked me about what is AI, what is machine learning. So we're going to train them on about 14 terms, and then we're really going to dive into GPTs. Why? Because GPTs is really the most, prevalent location most folks will ever touch AI. And we'll do some hands-on applications, some individual exercises, some paired exercises and group exercises, and we'll also do some solutioning session with some of the challenges our executives are bringing. We'll do it live, and that way they walk away with not only with the confidence of how a tool can enable them, but there's real-time evidence for them, and they can start to trust and believe. And that's got to happen. This is where AI fluency, this is where AI knowledge, AI training, and professionalism. And I think the sexy term now is upscaling, whatever the curt term is. Yes, it's really about AI fluency and being able to understand how AI can enable your organization and improve and optimize your organization, allow you to be more creative. And for executives, goodness gracious, having an assistant that can help prioritize and help you organize, not whether it's your email, your inbox, or maybe a project that you're wrestling with. All of those things we're going to cover in a one-day workshop, and we're really excited about it. Thank you, Cameron.
Well, it sounds like an incredible opportunity, and we get that question a lot, just in the work that we do and on this show is, what is AI going to mean for me? What's it going to mean for my business? What's it going to mean for my corporation? And what a great way to just learn and at least get some basic understanding with obviously the backing of the Texas A&M crowd, experts like yourselves at General Genomics, and of course the Fort Worth Tarrant County Innovation Partnership. We will be sure and put that link in the show notes so that people can learn more. And of course, you can find it on our social channels as well. We will be sure to blast that out so that more people can know this really interesting opportunity that's coming their way in May.
Well, thank you, Cameron. We look forward to doing it.
So, Chris, I want to shift to the last question we always ask on the podcast. I want to know what your favorite innovation is in Fort Worth.
I think what I really enjoyed seeing, and I didn't share this earlier, but as an adjunct professor at TCU, and what I see in the classroom, and then what I see in the private sector, what I see in the nonprofit space, I think what I'm most excited about is there is a buzz of innovation in Fort Worth that is going to complement the already phenomenal characteristics of the town that so many, when people come here, they're like, I'm all in Fort Worth. I know there's other towns in the Metroplex, but this is the one I care about. And the reality is just the innovation. I think what A&M is doing, A&M Fort Worth, with that leading with the law school, planning themselves here about 2+ decades ago. And now as they increase this really with an investment, not just buildings. It's not about the buildings. A building never did anything innovation. It's about the talent they attract. And in my conversation to Denise and her colleagues, I just think what A&M is doing downtown is going to move the needle for Fort Worth. But by the same token, I think the competition with the other private universities and public universities here within the Metroplex, this can be the Boston, Austin, and Silicon Valley. Why can't Fort Worth have its own flavor of innovation? Because that's the level of talent that's here. I mean, Cameron, I didn't say this earlier. Why are we in Fort Worth? I'm 800 meters from 7 hospitals. We are in the middle of the medical district, middle of the medical community. People need innovative solutions to improve their lives. So from an innovation perspective, I'm elated with what the A&M Fort Worth is doing, as well as some of the other organizations in town, because there is a buzz of innovation. It's about making not just technology. It's not just technology. It's how people think. It's how people solve problems. And I see it every day, Cameron. I guess that's what I'm most excited about, is just seeing an increase in the appetite, not only of the students, the citizens, the businessmen, small business, or whatever size business you're in. That's happening right now in Fort Worth, and we love it because we're a part of it.
Chris, thank you so much for joining me today on Fort Worth Innovates. If you like hearing stories about innovation, research, entrepreneurship, and startups in our city, please subscribe, share, and be sure to tell a friend. The more you engage, the more episodes just like this one that we can bring to you. If you'd like to learn more about the AI for Executives workshop hosted by the Fort Worth Tarrant County Innovation Partnership and General Genomics on May 29th, you can learn more and register in the show notes. You can also find us on our social media channels at Fort Worth Innovates. You can find us on Instagram, LinkedIn, and Facebook. Fort Worth Innovates is produced by Kendall Rogers. We'd like to thank our sponsor for this podcast, the Fort Worth Tarrant County Innovation Partnership, who are building an innovation district where technology and research combine to build the future, right here, right now.